If you love your Medicare Advantage plan, which surveys that the government conducts by people on Medicare Advantage overwhelmingly state that people like their Medicare Advantage plans. They like it, they're keeping it, they're happy. But the one thing they are generally unhappy about is roadblocks. And we call that the request for prior authorization. Your doctor says, yeah, your knee's shot. You need to have a knee replacement. You're like, cool, let's get that scheduled. I can't walk. And the doctor has to ask the insurance company for permission to schedule your surgery. The insurance company can say, nah, I don't really think so. Denied. So they don't have to tell the doctor why they denied it. And they don't have to tell the doctor an answer at all for in any time period. They can just, spend a month and just not your doctor not get an answer. And there's some bad blood out there because they might make the doctor fax it over. By fax. Why would they do it by fax? First of all, they do it by fax to slow the whole process down. And they might make them fax it 3 and 4 times saying, oh, I didn't get that. Can you fax it again? Just to delay. So people don't like this. And they've been vocal, which is good, and complained to the government. And they said, hey, why do I have these roadblocks to use my insurance? So the government has said, we hear you. We're going to make some changes to the prior authorization rule, but it doesn't start till 2026. So since they said that a couple of years ago, some of the insurance companies have been making some positive changes anyway, even though they don't have to until 2026. One of the largest insurance companies recently announced that starting just a month from now, that they plan to reduce prior authorizations on about 10% of requests that will impact their Medicare Advantage and their dual special needs plan. So that's a step in the right direction, especially when the large companies do it. That means all the smaller companies likely will follow suit. Now, one company has a plan that is beautiful. It's called a provider gold card, that they would go to you and they'd say, well, Dr. Sylvia, we've looked at your history. You don't prescribe unnecessary tests. You don't prescribe unnecessary x-rays, labs, blood work, surgeries. And so based on your performance, we're going to give you a gold card that will allow you to circumvent these roadblocks. You will have less requests for prior authorizations based on your history. So that's a good partnership between the doctor and the insurance company that benefits you, the client. So I would love to know if my doctor has that or not, because that's the doctor I want to go to. If I have a need for a knee surgery, I want to get my knee done. I don't want to have to be waiting and frustrated and have an unknown time when this is going to be approved or not approved. Now, starting in 2026, the government is making insurance companies, Medicare Advantage plans, they give them a timeline. You have this long to approve an emergency request. You have this much time, and you have this much time for a regular request. So they have to give you an answer. But they don't have to approve it. They just have to give you the answer quicker. How about a reason for the denial? Yes, the government is making them give your doctor a reason. If they say, Sylvia cannot get her knee replaced, tell me why. Say, Sylvia didn't do any physical therapy. We're not sure that physical therapy couldn't cure this. Sylvia didn't do cortisone shots. Sylvia didn't do... give the doctor something to go on so that the doctor can appeal that decision. Right now, it's a yes or no. And if they say no, how do you appeal a no when I have no idea what you based that no upon? So again, that won't start until next year, but it shows you that the government is listening to your complaints and the insurance companies are responding. Now remember, Medicare supplement plans, you don't deal with this. Medicare supplement, if your doctor says, Sylvia needs a new knee, let's schedule a surgery, they schedule the surgery. I might get the knee surgery on Thursday. Depends on his availability, right? The doctor doesn't have to ask the insurance company. The Medicare supplement company cannot approve or disapprove it. The Medicare supplement company works behind government Medicare. So if government Medicare says we pay for it, which they don't require prior authorization for almost anything, then the Medicare supplement pays. It's that seamless. Which is why, if you can afford a Medicare supplement, I always say there's less roadblocks, less hassle, less red tape involved, but you pay for that privilege, which is why I'm not pro Medicare Advantage or I'm not pro Medicare supplement. Our job at the Medicare Family is to educate you about the differences answer your questions, and help you pick the plan that you are the most comfortable with. If you need our help, we're free. Our services are free. We're independent contractors for the insurance companies. They pay us, so you don't have to. We're licensed in all 50 states. If you need our help, go to our website, themedicarefamily.com. And if you like this video, if you learned something and you want to keep getting ready for retirement, you know what to do. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.